Hello, folks. This is Pastor Mark here at Rabbit Creek Church. I'm here with Dr. Lindsay Cobb, our church member who is the medical director of Providence Hospital. And we're very glad to have her as part of our church and relying on her for expertise as we, as a community, church community and community broadly, face this coronavirus. We know that God is going to be working in this as we work together. And so, Lindsay, thanks for being here, and wanted to ask you for advice and suggestions on how we can best work together as a community.
Yeah, thanks for the invitation. Small correction, I'm Chief of Staff at Providence Medical Center, for anybody who knows the distinction. I have basically been in contact with the church about what we can do to protect ourselves and our community as a church group. Part of the reason that we need to make change is because of the progression of the disease, both locally and nationally. As I'm sure many of you are aware, we now have 9 cases in the state of Alaska, and we expect that number to increase. So really the goal is to keep the number somewhere where the healthcare system can continue to take care of everybody. If that number exceeds our capacity to be able to take care of you, then we start having to make really difficult decisions like they're having to do in Italy. We just don't want it to get there. So along that line, that's part of the reason we've gone to televised or remote viewing of our church services.
Yes.
And decreasing our gatherings. That's a recommendation of the CDC and by the Alaska State Department of Health. And in terms of meeting with small groups and things like that, the Department of Health has recommended gatherings be less than 50 and less than 10 where you can, and maintaining social distancing of less than 6 feet. All of that is intended to decrease the transmission of the disease within our community. So as a church community, I would say that your priorities should be first pray for your healthcare providers and for the patients and for the healthcare system at large, that we could problem solve these things and maintain our capacity to take care of you. Next would be to encourage each other in being responsible about social distancing. And so this is challenging, but it's meaningful. The intent is to slow down the progression of disease. So if you can do that, it makes it so that we can take care of you. And also, some of you may know me personally on Facebook and seen that I posted about mask donation. One of the problems hospitals are facing in taking care of people effectively and safely is the personal protective equipment, or PPE, that we use to keep ourselves safe and to prevent us from transmitting disease to patients. And there's a national shortage of those supplies. So if you happen to have any of those carpenter masks, or you have your own supply of N95s, I would petition that you donate those maybe to the church so that they can get them to your medical professionals.
And you can do that here at Rabbit Creek Church during the office hours, Monday through Friday, between 8 and 4. We'll have a place available for you both inside and outside if the church is locked after that time. We can bring those masks and contribute, as Dr. Cobb has mentioned. I want to echo her call for prayer. Please be in prayer for her, as well as our other medical professionals who are helping us during this time. And Lindsay, I was wondering if you could speak to, again, as far as the most vulnerable, how can we be helpful to those people who need to be best cared for and best treated in a way that is more sensitive during this time?
Yeah, so I think that there's a lot of people who have an understanding that there's a subset of the population that are higher risk with this disease. So maybe there's a sense that, well, if I don't fall in this high risk category, this doesn't pertain to me. But that couldn't be further from the truth, because you can still contract the disease and you may not even have that many symptoms, but then you can spread it to people who are then going to spread it to your grandmother or your aunt or your uncle or somebody, or even a younger person who's immunocompromised or has immune dysfunction or cancer or other things that make them unable to fight the disease. And so that's why you need to stay healthy, even if you are a young, healthy person.
So what is the first step that we should take if we believe that there is something that we're sensing that maybe we are experiencing some symptoms? What's the first step we should take?
Yeah, so the first thing we should all be doing is washing our hands like you've never washed your hands before. I want
Wash
to
those
see
hands.
scales and everything on your hands. Keep your hands away from your face. That's how you transmit disease. And maintain your social distancing. But then if you develop symptoms, they are beginning testing. And just to clarify any confusion about who's getting tested and why, if you're a young, otherwise healthy person without risk factors like travel to one of the CDC level 3 countries or without coexisting disease, and you develop a fever and a cough or symptoms, they may choose to not test you, and they may tell you to self-isolate at home to prevent spread of disease. The reason that they will not be testing young, healthy people without risk factors is because we have a limited number of tests available in the state to perform. And so until we reach the capacity to be able to test more people, we can really only do those who have symptoms of fever and cough, and then plus some other risk factor. And some of those risk factors include age over 60 or 65, a history of lung disease, a history of travel that would suggest that you might have been exposed, or healthcare workers fall in that category too, just because of the nature of our exposure.
Great, thank you. I want to encourage you as a church to remember that we are experiencing a different type of time in our lives as individuals and as a community, but we're doing this together. And I want you to face this with me and with us as we experience this with trust and hope. In light of that, I want to make sure that we all remember the importance of staying plugged into community. And we're going to have to do that a little differently, as you're aware, in the next coming weeks. Whenever we experience these kind of events, we have to be flexible, and we're going to be listening to Dr. Cobb and others for advice on how long these changes will be in place. But first of all, a reminder that each of our services each Sunday will be live streamed, and you can watch those live, or you can watch them during the week because they will remain on social media. But we also have our student and kids ministries on Tuesday, those also accessible via live stream and afterwards as well. So stay connected that way. Be watching social media as you will get updates throughout the week from our church dealing with ministry opportunities, health updates, previous sermons and discussions of those, and upcoming sermons, and then the messages themselves. Also during this time, we know that it's important that we continue to support our church and other ministries, and so encourage you to go online to continue your giving faithfully so that we can encourage the ministries that we're supporting outside of the church as well as within the church. And thank you for giving us time to address these issues with you. And we're praying for you as we do this together as a church family and a community.